Hi, everyone. My name is Julie Hook, and I am the program director at the Hope for Franklin County Coalition in Franklin County, Missouri. HOPE stands for Healthy Outcomes Through Prevention Education. And together, we provide programming for young people and for caring adults that we hope will reduce substance misuse among youth. Thanks so much for joining us today at our virtual reality Naloxone training simulation webinar. We are thrilled to partner with Walmart to present this unique virtual reality training experience. CADCA and Walmart initially launched this simulation back in February 2020 at CADCA's National Leadership Forum. CADCA then engaged with coalitions around the country to learn how communities can host events using this technology, getting amazing initial feedback, including how to use this VR tool as a standalone awareness event, to create a training around it, or to add it to trainings that are already being held. To date, CADCA has hosted more than 20 virtual reality screening events, engaging more than 2,000 participants. CADCA is looking forward to holding more events in the coming year and reaching countless new participants. Today, we are thankful for all of our partners, community members, and fellow CADCA members joining us virtually, and I'm especially thankful for my amazing team at the Hope for Franklin County Coalition, who have helped make today's event possible. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know our goals for today. First, we will hear from a wonderful group of speakers here in Missouri who are working every day to save lives. We are honored for them to be a part of this event. Later, we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. From these events, we plan to learn how to use this technology to better save lives and create a norm that every life is worth saving. Now I'm pleased to introduce our first speaker, CADCA's Chief of Staff, Valentino Murphy. Valentino joined CADCA in 2021 and has been working ever since to help further CADCA's mission of building and maintaining safe and healthy drug-free communities. We are thrilled to have him with us today and appreciate his insights from the national stage.
Thank you so much, everyone. I'm thrilled to be here for this very important event. First and foremost, I want to extend my heartfelt gratitude to Walmart. Their commitment to investing in this technology and, more importantly, in the people whose lives will be positively impacted by this life-saving training is truly commendable. I'd also like to extend a special thanks to our friends and supporters at the Hope Coalition of Franklin County. I consider it an honor to be on with such impressive leaders from the great state of Missouri. Finally, I want to thank everyone on today's webinar. CADCA has a footprint in over 30 countries worldwide and more than 5,000 coalitions across the United States. We seek to train community residents and leaders to build and develop coalitions in their communities and reduce substance misuse by adapting CADCA's model for community change. CADCA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. It's important to emphasize that prevention is more crucial than ever before. Recently, the CDC reported that over 109,000 drug overdose deaths occurred in the United States in 2022. This number may have leveled off since we experienced the highest number of overdose deaths, but there's still plenty of work to be done, and the CDC anticipates this number to rise as data comes in. To put it in perspective, that number would fill every seat in Busch Stadium 2.5 times. It's a tragic reality, and we must do everything in our power to address it. Together we are stronger, and as we train substance use and misuse prevention to coalitions every day of the year, all across the world, it's crucial that we have leaders and community stakeholders like yourselves fully engaged and committed. You are true heroes in your communities driving positive change. We need to continue to raise our voices on this in unity. Our partners at the Drug Enforcement Administration launched their One Pill Can Kill campaign, which aims to raise awareness about fentanyl-laced pills that are killing so many fellow Americans. DEA's message then is still the same now. If you did not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. As DEA Administrator Ann Milgram shared at CACA's 2023 National Leadership Forum to over 4,000 coalition members, this is not a war on drugs, but a fight to save lives. We also need to be vigilant of trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine as a key emerging threat, and it's one which interacts with opioids in a devastating way that leads to overdoses. An example of the spread of this dangerous trend, some cities are reporting that drug samples they are receiving rarely contain heroin, while 99% of them contain fentanyl, and 4 out of 5 samples contain xylazine. In this current landscape, we need every available tool to save lives and help our communities recover from this drug crisis. So please keep up the exceptional work you are doing. I look forward to seeing you in person the next time we're all together. Thank you for having me on today.
Thank you for those remarks, Valentino. We appreciate you joining us today and for all CADCA does to help support coalitions around the world. Now, it is my pleasure to introduce our first guest speaker. We're excited to introduce you to Dr. Michelle Getz. Dr. Getz began her career at Mercy in 2013, serving as a hospitalist in Washington. She then served as hospitalist director for several years prior to her transition to palliative medicine. Michelle is palliative lead for population health and an addiction medicine specialist, maintaining a robust outpatient palliative clinic in Washington. She and her husband Ryan recently celebrated their 10-year anniversary and have 3 young girls, Adeline, 8, Madison, 7, and Emerson, 5. Thank you so much for sharing your time with us today, Dr. Getz.
Naloxone is a reversal agent for medications, including opioids. Naloxone is given to remove the opioid off of pain receptors that you have all over your body, including your brain, your gut, your bones, your muscles, anywhere that can feel pain, does so through these pain receptors. And when in fact there may be too much opioid, there may be too much pain medication, naloxone can reverse that, and it displaces that opioid and kind of bathes that pain receptor with naloxone. Naloxone can be given a number of ways, including intranasally, which is how we often prescribe it to give to patients at home when we are giving them an opioid to take. We also have vending machines where you can get naloxone to reverse opioids if there were to be an issue or a problem, an accident, something that happens and you need help. You need it right then and there. Naloxone can do that. Naloxone can be given intramuscularly. Sometimes that is how we have to give it in places such as the ER in order to reverse that opioid and attempt to stabilize the acute issues that a person may be dealing with. We also can give it through the IV. Sadly, with medications such as fentanyl that is being made illicitly, not the fentanyl that we are prescribing to treat cancer-related pain that we're using through a fentanyl patch, or we use IV to help with sedation to do procedures like a colonoscopy. Those types of sedative opioid medications are not what is being made and being given, and medications being mixed together prescribed on the street, used on the street. It's much stronger and it attaches to those pain receptors in a much different way. And we're having to use IV in order to displace that illicit fentanyl off of that pain receptor and help to stabilize the acute issue. Anytime you are using an opioid, whether it be to recover from a surgery, whether it be to treat cancer-related pain, whether it be part of your treatment program for chronic related pain symptoms, whether it be because opioids and a number of medications like benzodiazepines and such are being used to help cope with physical, mental, emotional, spiritual, social, financial difficulties and challenges. Anytime we are using opioids, we should use naloxone. It should be given and available to you. Naloxone is much like your seatbelt when you're using opioids. You never buy a car expecting to get in a car accident. And every time you get in the car, you put that seatbelt on. And when that accident does happen, you're grateful it's there. You needed it right then and there. In many ways, naloxone is that for opioids. It is your seatbelt to help keep you safe, to help save your life. I'll never forget when my mentor said to me, Getz, I can't help anyone who is dead. This is true. We cannot help stabilize. We cannot help a person find stability. We cannot assist someone reach their full potential and what they could be if we don't have things like naloxone to assist. So with that, every time you prescribe an opioid, prescribe naloxone. Anytime you are going to use an opioid, including prescribed by physician or otherwise, use naloxone. Have it available to you.
Thank you, Dr. Getz, for such a succinct message on the role naloxone plays in this work. We are so happy to know that our neighbors can receive care from experts in the field, such as yourself. Next, I'd like to introduce you to Megan Maurer, Assistant Director of the Scenic Regional Library and one of our fantastic partners in providing community services, including recently working to host a naloxone vending machine at Scenic Regional Library in St. Clair. The Scenic Regional Library is a medium-sized public library. It's headquartered in Union, Missouri, and serves 147,000 people living in Franklin, Warren, and Gasconade counties in eastern Missouri. Altogether, the library has 9 branches serving 3 counties in a mostly rural area. Community members can learn more about their services at scenicregional.org. Megan Maurer has worked in and around libraries for 20 years. Megan holds a bachelor's degree from Eureka College and a master's degree in library and information science from the Catholic University of America. She is a member of the Washington Optimist Club, one of the court-appointed special advocates for children in Franklin County, and she serves on the board of Foundations for Franklin County. Megan, thank you for joining us today.
Hello, my name is Megan Maurer, and I am the Assistant Director for Scenic Regional Library with the headquarters in Union, Missouri. We are a public library that serves 3 counties, approximately 147,000 individuals. We have 9 branches over 3 counties. We were lucky enough to be invited to participate in this webinar to talk about our experience working with the Hope Coalition and Prevent Ed in Franklin County to install a naloxone vending machine or Narcan vending machine at one of our libraries. We started our partnership, Scenic Regional started our partnership with the Hope Coalition and Prevent Ed about 18 months ago. So in that time, I had the privilege of working with Julie Hook from Hope Coalition and Emily Wilkerson from Prevent Ed. And we were able to roll out a harm reduction service at all of our public library branches. So at that time, this was pre-vending machine, we were able to make available to our patrons locking books that they could secure medicines in. We also had timer caps and we had Deterra bags and some literature about where people could go to dispose of medicines that they no longer needed in their local community. So Emily and Julie were aware of the library's interest and passion in helping to provide services that look like a non-traditional service in a public library. So when you think about public libraries, typically people think about getting books and coming to the library for story time or getting on the computer, and all of those things still exist, and we still happily provide those services, but we also provide other services. And in our community, something that we really wanted to focus on was helping to invest in harm reduction. So that first looked like offering these items to people that they could come in, no questions asked, get them at the circulation desk. And then it developed into the possibility of putting a vending machine at one of our locations. So, as I mentioned, we serve 3 counties, and in Franklin County, we have 5 branch locations. And I talked with my director, and we talked to the library board about the possibility of putting a vending machine in at the branches and what that would look like. We had to take into consideration how much space the vending machine would take up and whether or not we could accommodate that space and where the vending machine would actually live. In preparation for talking with my director and with the board, I spent time with the folks from Prevent Ed and Hope Coalition talking to other libraries and other organizations throughout the United States who had already installed vending machines. Those conversations were very important in understanding the impact of the vending machine on the community, but also on the organization, and developing a plan for how we're going to talk in the community and prepare the community for why we need this vending machine and why having it at the library was a good fit. So I spent time talking with people in the Carolinas and in Kentucky and Indiana, and that helped us be ready to have the vending machine at our location. So we ended up narrowing it down to a couple of branches, and the type of vending machine that we needed and got required electricity. So that also helped us narrow down where we were going to put the machine. Julie and I went out and scoped out the facility where we were going to put the machine, which ended up being in St. Clair, Missouri. And the way that building is designed is that you can actually drive all the way around the building. There is, on the back side of the building, it used to actually be a post office. So the loading dock area, which is now enclosed, had a nice little overhang. There was a light there. There was electricity. It seemed like a great place for the vending machine. That's where it ended up going. It is there right now. It got there in October of 2023. I was there on the day it got delivered. It was very exciting, and we're so happy to have it. Thinking about why we really wanted to be involved is that the way libraries, public libraries, serve their community is definitely changing. I mentioned before that, yes, we have books, and yes, we offer programs for youth, and we care about early literacy, but we also care about our community as a whole and what our community actually needs, and we want to be responsive to that. So thinking about what our community needs and how we can help the community not only have access to things that they need, but also to help break down the stigma of those individuals who might need access to Narcan. That was a major motivator for us putting a Narcan vending machine at the library. We have had mixed reaction from the community. We have definitely had some patrons that have reached out to our branch manager and our directors voicing concerns about the vending machine. And we took those opportunities to talk with the patrons about why the vending machine was there, why it was important to have a vending machine in that particular community, as well as helping to inform and reduce assumptions about, again, who is using a Narcan vending machine and why they may need access to that vending machine. A major concern was about children and children being in the library. And while, yes, we do have children in our library, and they would be in a building where the Narcan vending machine is. The placement of our vending machine was around kind of the side to the back of the building. It's not right at the front door. That doesn't mean that kids can't go back there and see the Narcan vending machine, but it also gave us an opportunity to make sure that people understood that Narcan was safe for infants through senior citizens and that it could do more good than it could ever do harm. So it was an opportunity to educate and dispel rumors and assumptions about a Narcan vending machine. I will share a couple of positive stories that we have had. We had some guests come to a recent library board meeting in support of the vending machine. That was very impactful to our board. We had someone from the peer support specialist with Prevent Ed was able to speak and talk about the importance of Narcan and why Narcan was important in our community to individuals like him, because he was able to, his life was saved by Narcan. And that was very impactful. And also, we have recently received a phone call from a patron who came upon someone who he thought was experiencing an overdose and remembered that there was a Narcan vending machine at the library and went and got Narcan and was able to administer to a person who was in need of Narcan in that moment. And so another life we know was saved by having the Narcan vending machine at the library. So for those of you that are watching this webinar, I want to encourage you as a call to action to reach out to others in your community, your version of Prevent Ed, your version of Hope Coalition, and find out how you can be a partner, what that looks like in your community. And it may start off with things such as providing harm reduction things at your circulation desk, and it may involve putting in a Narcan vending machine. But it can be done. It can be done successfully. And we invite other people in the state of Missouri to take this opportunity to put Narcan in their community. Thank you.
Thank you, Megan, for your engagement in so many community services and for your partnership with our coalition. Next, we turn to our central providers for these community services, our friends at the Franklin County Community Resource Board. We're glad to have with us today Chief Program Director Danielle Lewis. Danielle has over a decade of experience working in child welfare. She helped create the Family Treatment Court in Franklin County to provide parents with substance use disorder the support they desperately need. She's an advocate for families, and she works to break the stigma around addiction. Danielle, we're so excited to hear from you.
My name is Danielle Lewis. I work for the Franklin County Community Resource Board. We own a building in Union, Missouri called the Family Resource Center. We purchased this building a couple of years ago. It's an old elementary school. What we do mostly is help fund a lot of agencies that provide mental health treatment to children and adolescents and to families. Since we purchased the building, we've been able to do so much more. We have 10 different agencies at this point in our building, all focusing on either substance use treatment, mental health treatment, prevention things for children and for families. It's just so exciting to see how the community comes together and how this is just a resource for people in our community. We're very rural. People have a lot of difficulty with transportation. So it's nice to have a one-stop shop where multiple needs can get met, especially for multiple people in the family. Some of the extra things that we have that we've been very lucky to have is we have a group that provides a meal once a week. Their hope is to try to expand that. And that's for anyone that needs the food, that needs a hot meal. So we have a lot of people that are homeless come up for that meal. Another thing that we're lucky to have is we're one of the 3 locations in our county that were able to get a Naloxone or Narcan vending machine. So that machine is free to use. It gets stopped by one of our partner agencies, Prevent Ed. And I know that it's only been installed for a few weeks. In those last few weeks, it has been used quite a bit. Some people that we work with personally, but are struggling with substance use disorder. They've taken multiple boxes to share with friends and family that are kind of struggling as well. So we're just glad that we're able to help get that more accessible for people in our community. Another exciting thing that we have here is we have an agency that does family treatment court for our Child Protective Services agency. So that court is set up if a child comes into care and it's due to parental substance use. If they choose, they can enter this program. It's very intense. It lasts a year, but so far they've seen great success. They have court more frequently. They have visits more frequently. They're able to get their children back at an accelerated rate, more so than they normally would, just due to all of the community the community supports and the wraparound parts of that program. So we're able to help fund that and participate in that. And that's been something that has really just been a beacon of light in our community. We also have a foster closet here that we're very lucky to have. Provides clothes, diapers, formula, and any like furniture that children might need to kids that are in care and to kids that are in need. All the local agencies that are in our building are able to access that closet as well. So it's just a way to get some of those items that are so needed out to people in our community. So we're just very lucky that we're able to have this space, and we're very lucky we can participate with all the wonderful agencies that are in our area. And I just really want to say I appreciate the opportunity to participate in this program and get the word out. So thank you very much.
Thank you, Danielle. We can't emphasize enough how invaluable your work is in supporting the efforts of our coalition. You're a true friend and caretaker for all of Franklin County. We're also excited to hear today from the host of our third Naloxone vending machine. And with this, we turn back to Mercy Hospital to learn more about their community health programs. We have here with us Rocco Gonzalez. Rocco is the Community Health Access and Informations Director for Mercy, one of the largest healthcare systems based in St. Louis, Missouri. Rocco uses both medical and non-clinical data to affect community-level change on the social dynamics that impact health outcomes, communicating his work broadly to the public and to key stakeholders through analysis, visualization, and strategic planning. Rocco finds innovative solutions by leveraging technology to integrate social care within the healthcare delivery model. He currently resides in Washington, Missouri, where Mercy has a very strong presence with a hospital and multiple clinics. Rocco, we're looking forward to hearing from you.
Hello, I'm Rocco Gonzalez. I'm the Community Health Director for Mercy, Washington. So really, since I started my career, I would say opioids, substances has always been truly an epidemic in our nation. And no surprise, as we've been developing our community health needs assessments, we've seen it really time in and time out, how substance use, mental health, one or the other, sometimes both, always get to the very top of our prioritized needs. In doing that, we really have seen the prevalence, whether it's substance use disorder, overdoses. We're hearing from our community that they really need more resources to not only really address the substance use epidemic that we have here, but then also how do we get it more upstream and really learn and be more engaged to understand how we can really prevent people to go down this road. What's been interesting now is as we've been trying to get more awareness, once again, not just internally in healthcare providers, but also throughout the whole broader community, it's been very interesting to see both the positive and the negative reactions. Specifically here in the Washington region, we've seen a few really key interventions, some type of things that we've developed, whether Mercy ourselves has created or something that we've partnered with a nonprofit organization to really create something to help combat this epidemic. The first main proponent really was our Mercy Substance Use Recovery Clinic. So it's something that, once again, we've seen over the last decade, really, substance use being a core need of our community. Now with the clinic, we actually have 5 days a week between Union and Cuba. So it's really between two different ends of our county, but fully timed throughout that business week. We really have a care team that focuses on all forms of substance use disorder. Once again, not really leveraging any other type of healthcare, but focusing solely on something that really has impacted so many people around us. Another piece, and as we really have defined that and then expanded it to reach really hundreds of people each month, we knew that there were other things that we needed in order to really get holistic care for all those in our community. In doing that, we then have collaborated with PreventEd, a really core partner here to help address the Certified Peer Specialist program. It's very similar to what you might think it would be. It's a peer, so someone that is currently in their recovery journey, to actually walk alongside these people, whether they're coming into the emergency department currently overdosed, actually walking once again with them through their recovery, through their, whatever it would be, healthcare, personal, professional lives, so that they can actually have a real life experience in order to help really address a lot of the questions and a lot of maybe the moments of weakness that might make someone want to turn back to that substance. The other two that I want to talk about are more recent, but I really believe are the most critical because they address both the immediate need, for example, if someone's currently overdosed, but then also the other solution has connections to that ongoing, almost lifelong relationship and that recovery journey. So the first solution is that naloxone vending machine. It sounds kind of strange when you think of, hey, why are we having a vending machine that gives out free medication? But whether it's the research, whether it's different examples across the country, you've seen all these different examples of having publicly available naloxone, which really then helps people truly survive an overdose, has been so critical for not only avoiding overdoses, but really empowering and engaging those at risk for substance use disorder. So us using one actually in our medical campus has been just one example of how we try to give that dignified access to a need, to a tool like naloxone for our community. The other solution I was talking about that is hopefully going to help any person really stick to their recovery is our virtual substance use recovery program. So this is a completely virtual program in which we have licensed clinical social workers, psychiatrists, and really professionals in substance use disorder treatment actually work with patients virtually, but then also providers to ensure that they not only understand what are the steps in order to really, in their care plan, to really get to the next step of recovery, but also help that healthcare provider feel comfortable and confident because they're the ones, the local provider, that has the relationship with the patient. So think of it almost like a train the trainer model, or we're just trying to help coach and really empower everyone to be able to make the appropriate steps. So in doing that, not only have we tried to create connections to the healthcare, the medical, clinical interventions that we know are so important, but we also have leveraged our community health worker program. So these are key coworkers that help connect these usually underserved people to the necessary resources for employment, could be food, could be utility assistance, really anything that may once again lead them back to that substance that they've tried so hard to try to give off. If any of this seems like it's really relevant or really speaks to your heart, please feel free to reach out to your local Mercy Foundation, or whether it's donations of your time, of your resource, of anything, we definitely hope to have you help in this effort to really walk alongside and companion with our community members that are going through the substance use disorder recovery.
Thank you, Rocco. We are so grateful for your work in providing these services. You're a true bridge, bringing the clinicians into the community and the community into the hospital. Our final guest speaker today, before moving on to the virtual reality demonstration, is Ryan Doherty, a certified peer specialist and harm reduction specialist with PreventEd. Ryan has been a peer specialist working in the field for 3 years and has been in recovery from substance use disorder for 4 years, following more than 2 decades of substance misuse. In the past 4 years, Ryan has established an amazing new life, and he finds great fulfillment in sharing his experience with individuals who are currently struggling with substance use disorder, helping share a dream of hope for those who need it most. Ryan, take it away.
Hello, everybody. My name's Ryan, and I am a certified peer specialist with PreventEd, and I thank you for this opportunity. And I'm just going to share a little bit about my experience in recovery and a little bit about the work we're doing here at PreventEd. I've been in recovery for 4 years. I struggled with a little bit of everything. My favorites were meth, opiates of every kind, and benzos. About 4 years ago, I got got arrested, and at the time I thought it was the end of the world. But looking back, it was a blessing because that's what started me in my journey of recovery. Got put on probation, was doing lousy on probation, and I had a very strict PO, which looking back on it, I couldn't be more grateful for how strict my PO was, because had he let me get away with a lot, I would have took advantage a lot. I ended up overdosing while I was on probation, and needless to say, my PO didn't much care for that. And he gave me the option. He told me I could go to treatment or I could go to prison. So, like anyone, I chose treatment. I'd never been to treatment before. So I was scared, but I was kind of excited too about the opportunity. So I went, and it ended up being a wonderful experience for me for several reasons. The first being is we were able to go to church on Sundays, and God was with me. I got saved, and I feel like that sparked hope inside me. That with the combination, I had never heard of peer support at the time, and there was a certified peer specialist at Gibson Recovery where I went. His name was Scott. Shout out to Scott. He's awesome. He gave me hope when I had none. Uh, he showed me that it was possible, that people can change, people do recover, no matter how dark things get. There is hope on the other side. You just got to be willing to work for it. And so I learned some tools while I was in there. And the longer I was there, the more I knew that peer support is what I wanted to do. So I got out of treatment and did everything I was told to do, the 90 meetings in 90 days, got a sponsor, worked the steps, I kept going to church on Sundays. And I, at a meeting, I met someone who told me about this company I'd never heard of called Prevent Ed. And she said that they were hiring for peer support. So I'm like, awesome, that's great. I was in the process of training to become a peer specialist. So I got the job, and like I said, Prevent Ed, I never heard of it. It's like felt like one of the best kept secrets in our area. It started with 2 peers. Now we have 5 peers, and working in 2 different counties. Franklin County is where I work. For our agency, we take referrals from all over Franklin County. I mean, sometimes it may come from a judge, may come from a lawyer, probation, people off the streets. We show people a different way to live, how to live sober. Sometimes people just might need resources. It may be someone just needs to find treatment and they don't know where to look. So we help them find, treatments they can go to that's paid for through the government, or one of our local treatments sometimes does scholarship programs, so we can help them apply for that. Sometimes we help people get into sober living. We can basically help them with any type of resources that they may need. One of the other cool things that we're doing is we are getting the word out all over the place about naloxone. Our local judge in Franklin County actually asked us if we would come into the courthouses and set up and offer free services, free peer support for anyone who may be interested. And we also hand out naloxone in the courts, because what better place to set up than in the courthouse. So that's been going very well. I have a lot of great conversations with people who, maybe questioning naloxone, think it's like they don't totally understand it, or they may think that it promotes drug use. And so I can have some really good conversations with people, explaining to them that naloxone, all it does Well, I mean, it keeps people alive long enough for them to possibly seek treatment. You know, unfortunately, a lot of people that are overdosing are people who don't use fentanyl, or at least they're unaware of they're using fentanyl. Uh, you know, a lot of the overdoses are from people who, for instance, get a Percocet and they think it's a Percocet, but it's not. You know, and they'll take that one pill and they overdose. You know, and thankfully we have awesome laws now that called the Good Samaritan Law that will allow the person to call 911 and no one gets in trouble. So, because before people were dumping people off at the hospital or just leaving them for dead. And so now that doesn't happen near as much. It still does sometimes, but not nearly as often. Naloxone is truly, you know, it's saving a lot of lives. It's keeping people alive long enough to engage in treatment. Uh, for like me personally, I wouldn't still I wouldn't be here right now if it wasn't for Narcan. I when I had overdosed, they had to Narcan me 3 times to bring me back to life, and so I will forever be grateful to the paramedics, the person who called 911, and to Narcan. It saved my life, and it's saving lives all over the place, you know. And it granted, Narcan isn't the solution to the problem. uh Prevention, I believe, is where it starts. And you know, that's the other big key that our agency does is prevention education. We go into schools and stuff. If we could catch it before it starts, you know, that would be beautiful, because once it starts and you get stuck in that cycle of addiction, it's just it's so hard to get out. You know, it's a trap that consumes your soul and your life, and every decision you make is based around that drug, and it takes over. And it's very hard to get out of. And when you first get sober, you feel very alone too, unfortunately, honestly, more alone. And that's when it's great to have peer support, because you know, all these people you thought were your friends in your addiction, as soon as you don't have drugs, they're all gone. So that's why it's one of the many reasons, I should say, it's awesome to have peer support, because we can be there for people when they don't have anyone else. Some of the final things that, you know, are coming across my mind that I guess I would like to say are, you know, addiction affects everyone. You know, it's not just one person it affects the whole family. And when you're in the addiction, you don't realize that. You think you're just hurting yourself. You don't realize you're tearing your family apart. And but the good news is, for people who are struggling, is all those relationships you think you've destroyed, most of them you can heal. You know, uh, I have an amazing life today that wouldn't have been possible had it not been for Narcan and peer support. Honestly, I mean, there's a lot of other things that go into it. Recovery is something that you have to work on every day. You know, if you're not working on it, if you're not pushing forward, you'll be finding yourself falling backwards. You can't stand still. You always got to be pushing forward. Just work hard. You know, always be striving to do better. You know, and life will get better. It's hard in the beginning, and you know, life just keeps happening. You know, sometimes it's great, sometimes it's not. You know, but I've learned to push through those bad days, because they, you know, they don't last forever. Usually the next day is always better.
Thank you, Ryan. Your work and your words are deeply touching, and we're wishing you all the courage and resources you need to continue the amazing work you do. We'd also like to thank all of our speakers today. Each one of you are doing so much to raise awareness and expand services in this challenging environment. We're grateful. And now we will view the virtual reality simulation portion of this event. Walmart has invested in training their associates, including through the use of virtual reality. Walmart's virtual reality-based training was developed as a tool to build skills in unique training situations that are hard to replicate in a classroom setting, such as front-of-store, customer-facing technologies. This technology led to the development of non-retail trainings, such as the VR we will see next. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer Naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good. Hey.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Dude, your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan!
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you to the Walmart team for developing this powerful tool. We are so excited to work with you to connect this training with community members. We also want to extend our thanks again to all of our speakers tonight for their hard work and for sharing their perspectives, and to all of you for attending the event. We truly appreciate your time. Please reach out to CADCA or to my team at the Hope for Franklin County Coalition at any time. We're now finishing the hour and we'll conclude the webinar. I wish you a great week. Thanks for coming.